Continue to get your coronavirus questions answered. So joining us tonight is Dr. Kristen Moffitt with the Division of Infectious Diseases at Boston Children's Hospital. Thank you so much for being with us. We really appreciate your time. So in Massachusetts, about 2% of people who've tested positive, they're either 19 years old or under. So have we learned anything new about how COVID-19 affects younger kids, how it affects teenagers?
Yeah, so we are starting to get a bit more data around breakdowns in individuals under the age of 19, but the data are still relatively lacking. There is some sign from the largest pediatric case series out of China that children under the age of 1 had a higher hospitalization rate than other children of other ages. But this may not be too unexpected, given that small children under the age of 1 in general, tend to require potentially higher levels of intervention in fighting any respiratory infections.
Right, and possibly immature immune systems?
That could certainly contribute as well.
Right. All right. So a lot of people running into childcare issues right now with schools closed. A lot of times older relatives, grandparents, they're the backup. What's your advice in that situation?
Yeah, I think that's certainly a really difficult situation to be in. I think families really need to have very open conversations that balance the risk to the potential older childcare provider. I think those considerations need to include the age of the potential childcare provider and whether or not they also have additional underlying risks or underlying medical conditions that might put them at higher risk for much more severe coronavirus infection.
Okay.
And that may involve discussions between that older childcare provider and their own physician as well.
Okay. All right. Good advice there. A lot of parents, though, some are relying still on daycare, especially we're talking about first responders, medical professionals, like yourself. Are there any extra precautions for parents in that situation whose kids are still in daycare?
Sure. I think it's really important for families who are still needing to rely on daycare centers who are providing this critical service to have conversations with them about what those daycare centers are enacting in terms of enhanced protocols around hand hygiene. I know a lot of the daycare centers who are continuing to provide this critical gap in childcare coverage are doing a lot to make sure that there are regular health assessments in place, both for their staff workers, but it's important for the families who are sending their children to childcare centers like this to be doing those own health assessments for their children in order for those centers to be able to stay open.
Sure. When in doubt, just ask. All right, Dr. Moffitt, Thank you so much with Boston Children's Hospital. We do appreciate your time.
Sure. Thanks for having me.